am Dr. Sankar Annangi, consultant and interventional cardiologist in Sravani Hospital, Guntur district, Andhra Pradesh. Today, I am here to discuss and enlighten about hypertension and latest updates in hypertension. Raised blood pressure is the most important risk factor for cardiovascular disease. In cardiovascular related diseases, contribute 27% of the total deaths due to non-communicable disease in India. Hypertension is one of the modifiable risk factors for atherosclerotic cardiovascular disease. Despite advances in the treatment and prevention, it remains major cause of mortality and morbidity because of low awareness, lack of appropriate care, and poor follow-up. In India, prevalence has gone up from 29 to 38% in men, 28 to 32% in women over the last 30 years. And greater than 50% of the population were unaware of that they are having hypertension, and greater than 60% of the men and 50% of the women did not get the proper treatment even though they have diagnosed hypertension. International Society of Hypertension 2020 Global Hypertension Guidelines also addressed the same issue in the resource poor settings like low social countries like India. And coming to the basics of hypertension, definition of hypertension is defined based on the level of the blood pressure recorded, and usually generally it is defined as a level greater than 140 systolic blood pressure by 90 diastolic blood pressure, and it is considered as a hypertension. But it varies depending upon the method of measurement and society of guidelines which we are following. Various methods which are useful for diagnosing of the hypertension are office blood pressure measurement, that is nothing but a blood pressure measurement in a hospital setting, and 24 hours ambulatory blood pressure monitoring and home blood pressure monitoring. In 24 hours ambulatory blood pressure monitoring, one device is connected to the patient which records the blood pressure 30 minutes to 1 hour over 24 hours in a home or office setting with the continuing routine daily activities of the person. Advantages of this 24 hours ambulatory blood pressure monitoring is it is clearly defines the white coat hypertension and masked hypertension. Masked hypertension is nothing but patient office blood pressure is not elevated, but home blood pressure is elevated. And white coat hypertension is nothing but patient office or hospital blood pressure is high, but his actual blood pressure is not elevated. So the advantage of the 24 hours ambulatory blood pressure is clearly differentiate white coat hypertension and masked hypertension. And home blood pressure monitoring is useful, especially in a monitoring of the patient with the patient is on treatment. And coming to the definition of the hypertension, it varies depends upon the society of the guidelines which you are following. Most of the recent guidelines define hypertension in adults above 18 years of age is greater than 140 systolic and diastolic greater than 90 millimeters of mercury. However, the guidelines definition differ from the ACC, American Heart Association guidelines, from the other guidelines, including European Society of Cardiology and International Society of Hypertension, and also Indian guidelines for 2019. In ACC, AHA redefined hypertension as a greater than 130 systolic blood pressure by 80 millimeters of mercury of diastolic in their guideline published in 2017. In other ESC and other all societies of remaining guidelines, the blood pressure was defined as a more than 140 by 90 millimeters of mercury. When coming to the causes of hypertension, what factors causing the hypertension, approximately more than 95% of the adult population, there is no direct cause of hypertension, which is usually we call as essential hypertension or a primary hypertension. Remaining 10% of the causes, the cause is identified like kidney disease, hormonal disturbances like endocrine disorders, and some genetic disorders. The factors which are responsible for hypertension, like our lifestyle, daily lifestyle factors, which influence the blood pressure. For example, nicotine in cigarette smoking increase the blood pressure more than 10 to 20 millimeters of mercury, and also decreased physical activity, obesity, weight gain, that also will increase the blood pressure, and also increased intake of sodium consumption, especially in Indian settings, where we use more of pickles and other salted products for preservation of the food. And ICMR also showed average daily salt intake of Indian population is around 13.8 gram per day per a person. So increased sodium intake in the form of salt is one of the most important risk factor responsible for the hypertension development. And also decreased potassium content also increase the blood pressure. And consumption of sugar sweetened soft drinks, which increase the weight gain, overweight, and obesity, and also it leads to diabetes and hypertension. And moderate to heavy alcohol intake also cause development of the hypertension. These are the general lifestyle factors which are responsible for the development of the hypertension. Coming to the management of the hypertension. So what are the therapies and what are the methods which are available to control the hypertension? It includes two modes of management: pharmacological and non-pharmacological therapies. Non-pharmacological therapies include dietary modifications, cessation of smoking, and control of the body weight and physical activity. Non-pharmacological therapy includes various drug methods. The ACC, or American Heart Association, have released a scientific statement in 2021 offering the new guidance for the management of stage 1 hypertension among the patients with low atherosclerotic vascular disease. Among the low-risk patients, that is with atherosclerotic 10-year CVD risk less than 10%, stage 1 hypertension, management starts with non-pharmacological therapy. If the blood pressure remains uncontrolled at 3 to 6 months, it considers the starting of the pharmacological therapy. So what are the non-pharmacological therapy? Includes salt restriction. Salt restriction to less than 3 grams per day is usually recommended in a patient with hypertension. And also the diet rich in potassium, like yellowish citrus foods, bananas, papayas, amla, pineapple, and watermelon, which is rich in potassium content, will help in reducing the hypertension. And other diets which are recommended, most of the society of the guidelines recommend particular diets in a patient with hypertension. They are called as the DASH diet and Mediterranean diet. DASH diet is a dietary interventions to stop hypertension. Persons adopting the DASH diet will reduce the blood pressure around 8 to 14 millimeters of mercury. What are the diets which containing DASH diet? Are nothing but fresh vegetables, fruits, whole grains, cereals, walnuts, almonds, and hazelnuts. Food with increased fish intake, low fat dairy products, low intake of sweets, low intake of sugar sweetened beverages, low intake of red meat, low saturated food, and diet which is increasing the potassium content, magnesium, calcium, and proteins. Another method is Mediterranean diet, which is containing the higher amount of intake of fruits, vegetables, fats, including 32 to 35% of the total calorie per day, less than 10% of the saturated fatty acids in a total calorie of a person, high intake of polyunsaturated fatty acid intake. Most of the randomized controls and meta-analysis shows that persons taking the Mediterranean diet or DASH diet have a reduced 29% relative risk reduction of cardiovascular diseases over the 5 years. Another method, non-pharmacological method, is body weight reduction. Dietary advices to reduce the body weight and physical activity will decrease the blood pressure. Body weight reduction of around 5 kgs will reduce the systolic blood pressure of 5 millimeters of mercury and 4 millimeters of diastolic blood pressure. And another method is the physical activity. Physical activity of moderate dynamic exercises of 30 minutes for 5 to 7 days a week will reduce the blood pressure of around 4 to 10 millimeters of mercury. Physical activity in turn reduce the body weight reduction and will also cause reducing the systolic and diastolic blood pressures. Another method is the smoking cessation. Nicotine, which is present in the smoking, is a addictive function. So sudden stoppage of smoking will cause withdrawal symptoms. Withdrawal symptoms can be avoided by nicotine replacement therapies, which are provided nicotine in a controlled manner. Also useful for a smoking cessation. The drugs are also available for reducing the smoking. And another method is the stress management, which is by yoga or meditation will decrease the hypertension by reducing the sympathetic activity, which is the main important factor in the development of the blood pressure. And coming to the pharmacological management, various drugs are available for pharmacological drugs are available for reducing the hypertension, and depending upon the target of the blood pressure. Various targets so how far we can decrease the blood pressure will depends upon the patient condition, like a patient having other comorbidities like any previous heart disease, previous diabetes, hypertension, previous stroke. These risk factors will decide how far you can decrease the blood pressure. There is a controversy regarding the how far you can decrease the blood pressure based on the recent randomized control trials and meta-analysis. There are various targets are available for reducing the blood pressure. Generally, for a old age population, it is advisable to reduce the blood pressure below 140 by 80 millimeters of mercury. Whereas in patients with other comorbidities like stroke, heart disease, and diabetes, it is advisable to reduce the blood pressure to less than 130 millimeters of mercury. And various class of drugs are available. Most commonly used drugs are diuretics, AC inhibitors, calcium channel blockers, and beta blockers, especially useful in patients associated with heart diseases. And recent guidelines also providing emphasis on the single pill combination therapies. This is because there is a poor compliance and poor adherence to the therapy of the BP control because of the multiple classes of the drugs having multiple side effects, and cost of the drugs will cause poor, improper adherence. So single pill combination therapy is more advisable in the recent guidelines. The advantages of the single pill combination is to increase the compliance, decrease the cost of the drug, and it is having less side effects, counterbalancing the side effects of different classes, and having a synergistic activity. Recently, International Society of Hypertension 2020 guidelines also provided emphasis on the single pill combination therapy. Thank you.